Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. It's me and Taylor here today. Girl episode. We have Dr. Hogan with us, who is going to be giving all of her expert insight. We always want to start off by thanking our sponsors, Rejuvime Medical, the age-defying clinic, where we take care of all things hormone replacement for both males and females, GLP-1 therapy. We are all over the state of Louisiana. We also have a clinic in Mississippi. And we also would love to thank Weiler Plastic Surgery Group, the largest plastic surgery practice in the state of Louisiana, with 5 board-certified plastic surgeons and a ton of expert injectors and estheticians to help everyone meet those goals that we're always trying to chase after. So I would like to thank both of them and welcome Dr. Hogan. Thank you so much.
Dr. Hogan, Melissa Hogan in the house.
Thanks for having me.
I know, that's what I was like, look.
She is literally on the clock. I mean, she's got to do these 2 podcasts and she's going to operate all day and then she's going home to manage
flag
3
football
boys.
and baseball and soccer.
Okay.
So it's fine.
So yesterday I was dying laughing because I was talking to one of the girls that we work with who doesn't have children. And she was like, oh man, I guess I'm gonna go home and I don't know, I'll probably grab something to eat and then watch a movie. It's nothing good in bed. I'm like, what? I live a whole nother life when I leave here.
I run out the door with coffee at 3 p.m. to start my second job.
Correct.
Just start it up.
Start
of all the
your
activities.
other day.
Yes.
That's what I'm like. I have a whole day prior to getting here, and then I have this day, and then when we leave,
So
got a
you were
whole nother
saying
one.
you leave at 4:45 in the morning to get here to operate.
Yes, OR days I start operating at 6 a.m. So I leave my house at 4:45. I get here around 5:40, and then I operate usually 6 to 2:30, and then drive home and then get the kids for 4:30. Yes, coffee, and then kids for 4:30, and then we start all the activities.
I mean, do you go to bed at 8 o'clock?
On Mondays and Wednesdays, so my OR days are Tuesday, Thursdays, I literally will put down my youngest at around 8:30, and then I turn the oldest over to my husband. I'm
This
like,
is
you go to
your
bed.
problem. It's
I can't do this. Yes, I physically, I'm like, I cannot, so I'll kind of doze off around 9:30.
Okay.
And so, yeah. So just on the OR days. The other days, that's, 10, 11.
So you got a
So I'm
little bit of
all kinds of mess.
You have a little bit of a hike from
Yes.
where you're coming to your OR days.
Yes.
So on your way in, I always like to, because I mess with Dr. Weiler about, are you a podcast listener? You're like a music listener, in the morning to get ready?
Are you a silent?
Silent driver.
Mornings, it's a podcast, usually some sort of true crime. But then that gets a little heavy sometimes. So then I'll kind of shift to lighter podcasts.
Murder at 4:30.
Sometimes a little much. And then some afternoons it really is just straight silence.
Yeah.
I'm like, this is the last time it's going to be quiet until everybody gets to bed.
Okay, do y'all remember? This is a random thing, but there used to be a show on the Discovery Channel that was called Brain Games, and it was about how your brain worked and stuff like that. And I'll never forget the episode because this is when I used to work in the hospital. So I'd leave really early to get to the hospital and, you do your 12, 16, and then you're going home. And it's like, have you ever left one place and drove to another place and forget the entire drive?
100%.
And I was like,
Yes.
more than
Yes.
I care to mention.
Yes.
And it's typically those silent drives.
Uh-huh.
where it's
I'm like, oh, this is nice. I'm like, how'd I get home?
you don't even realize the radio's not on. You're just driving and just going.
Worship music and hot coffee in a car by yourself, and it's blaring is medicine to me.
That's your thing.
So I've
Truly.
It was funny. I was never forget. I was driving a couple months ago, and Dr. Weiler called. He was calling for something, and he's like, "So, what are you doing?" I'm like, "I'm just driving," and I'm like, "He's like, is it just silent?" I'm like, "Yeah." Really. I'm like, "How did you know that?" I'm like, "Are you listening? What's happening?"
So I started noticing the other day. I'm taking both of my children to a concert tomorrow.
Lainey Wilson?
No, ma'am.
No, what you going to?
No, ma'am.
Maddox
We are
Batson?
going. No, ma'am. We are going
Zombies.
to the Descendant Zombies.
Are you really?
Worlds Collide tour at the Smoothie King Center.
Sibley would freak out. Oh my
Taylor,
gosh.
I had
We
2
blare
extra
it.
tickets. I could have given them to you, Taylor.
Oh my gosh.
But we have okay, so we're checking the kids out of school because
Right,
duh.
gotta do it.
And we have like this whole thing set up. They're all dressing up as characters and all of that
Oh
stuff.
my gosh.
But what I've noticed,
Wait, so that's in New Orleans?
it's at the Smoothie King Center. I'm
oh my
so
gosh.
excited.
Okay.
So, and we're taking 10 girls, second grade. They're all second grade, and 2 of the little. I'm taking my youngest, and my best friend Lacey is taking her youngest. So Hemingway and Ellie are just like getting into it. So we'll see.
Oh,
but like
my.
Ellie's dressing up as like the little Mal. And Cecile's Evie and like Audrey, like all this stuff. But what I started noticing is taking place is when my kids are in the car with me, we're listening to Descendants and Zombies and everything like that. But they'll get out of the car, and I'm just still like rocking out to Descendants and Zombies.
Do you know the?
I have no idea. I don't have girls.
This is
I,
because you don't
it's
have
a girl
girls.
thing. I have
Yeah,
all
this
boys.
is-
I'm missing something here.
At first, I was like, "Why do you want to listen to zombie music?"
Wait,
Yes.
but it is not like
It is
that.
not.
wait,
No.
is it okay?
Okay, it's
so,
the children
okay,
of the Disney princesses
so
and Disney
I had to
villains.
drive home 2 little girls from baseball one
Yes.
day, and like they're like, play the Descendants, and
Yeah.
like we were listening to it. I was like, this is catchy.
It is. It's
I'm
actually
like, what
really
is
good.
this?
It
And
really
I'm like,
is.
and I've never
Alright.
circled back, but I'm like, oh, this is like a concert
Yes.
situation.
And
Okay.
like my whole entire house, you would have just, I mean,
Okay.
when Zombies 4 came out a couple months ago,
So fun.
it's all we watched. And then it's the Daywalkers and the Nightwalkers and the Stones and all this kind of stuff. And it was so funny. So we have like a group text message. We have a group text message going between like all the moms and whatnot. And it's just when Zombies 4 came out, one of the moms was like, nice playlist coming.
So good.
Zombies 4.
So good.
So yeah, we're going to the Zombies and Descendants concert. I'm so excited.
It's going to be amazing.
We made them all like, we got personalized like the little clear purses, and they have like little makeup bags and like little makeup things. All the things. We have the
Precious.
hair. I'm so excited.
Foreign.
You
I'm
have
like,
no
I
idea.
don't know what's happening.
You
but
have.
I could tell you about baseball.
Yeah,
That's all I can
right.
tell
That's
you.
what I'm like. Well,
Okay, I'm so excited about today.
Yes, this is a good talk. I love talking about
Brachioplasties.
Wait, I absolutely
Brachioplasties.
love this.
Mm-hmm.
I absolutely love this. Okay, so yes, we are talking about brachioplasties. So tell us what that is, Dr. Hogan.
So a
First-
Oh, go ahead.
oh, sorry.
Oh, sorry.
Who's Dr. Hogan? Tell us
Oh,
about
yes,
you.
please.
Oh, I am a board certified plastic surgeon. I've been with Weiler Plastic Surgery for about 4 years. Been in plastic surgery for 10 years. I have 3 kids. My main offices are Covington. I'm at Slidell and Hammond and a little bit of Denham. So I basically am up and down the whole I-12 corridor. So basically, if you
In
need to see
Louisiana.
me,
Yep.
I'm at those locations and
Specializing in body contouring, surgical, breast, tummy, arms,
Yes.
legs,
Everything
all
neck
things.
down.
Everything
All the neck down.
Yep.
Neck down.
So, okay, sorry.
All right. So-
What the heck is a brachioplasty,
Yeah,
Dr.
what is that?
Hogan?
So a brachioplasty is it's basically a skin removal of the arm. So patients come in and the main complaint is usually quote the bat wings. Like I've got this hanging
Or lunch
skin.
lady.
The lunch
Lunch
lady
lady arms,
arms,
bus driver arms,
bus
bus
driver
driver, yeah.
arms. So those are patients that come in and they're just not happy with that extra skin. So what we do in a brachioplasty is we're going to actually remove that extra skin.
Love that.
Is it just like a simple, like little, like beep?
It depends. Some patients have smaller amount of skin, larger amount of skin. It's not a horribly painful procedure because it really is at the end of the day just skin removal. We're doing it in combination with liposuction to give you a little bit of contour of that arm. But it's like I said, it's not a terribly painful.
Talk about the
procedure.
natural aging process of the arm. Why are we looking at arms? What happens?
I always tell patients brachioplasty is one of the hardest surgeries to kind of not sell to patients, but like to kind of get patients to be on board with. When we do facelifts, you're hiding that scar in the hairline. Breasts, you're hiding the scar in the bra. Tummies, it's hidden in the underwear. And thighs, for the most part, you're going to be covered by jeans or pants. The arm is kind of a hard area. Like we're taught to, as plastic surgeons, we're taught to kind of camouflage scars. But this is one of those scars that it's really hard to hide. Like we're in Southern Louisiana. Like patients like to wear sleeveless. It's so hot. So it's one of those scars that is a little less easy to hide. And patients that are coming to see me are, hey, I would rather the scar than the skin. And that's kind of, they've kind of reconciled, like, I'll take the scar rather than have this excess skin. And that's what they have to kind of reconcile. So it is kind of one of the harder procedures because it is harder to hide these scars. Yeah. But at the end of the day, I have never had a patient come back and say, hey, I wish I hadn't done this. This is one of those ones that's really satisfying.
Because it's like one of those things that you think about. If you are doing this type of procedure, you want to feel more confident in sleeveless outfits and stuff like that. So the fact that you are saying, like, I'll take the scar,
Yes.
to, just to have that comfortability back in wearing those types of shirts and stuff and dresses and everything. I feel like that is, that speaks volumes to how important it is for somebody who's getting it done.
And then I also have people that, like, they're like, I have to buy an extra large shirt so that my arms fit in it. So like at this point, like, I look even more bulky than I actually am because I'm trying to fit my arms into the sleeves because I don't like the way that the sleeve kind of pinches me or looks kind of funny. So it really, and then like I said, with the GLP-1s, we're seeing a lot more of that massive weight loss. So that skin doesn't snap back. It doesn't come back after you've kind of stretched it out to the max. So there really are no options besides just actually removing it directly by making that incision.
Okay.
Yeah, I feel like as we age, we lose collagen and elastin,
Absolutely.
obviously everywhere, but I think that it's more visible in specific areas. And I do think that as we age, we see the skin involvement of the arm whenever we lose even a little bit of volume,
Yes.
primarily in the arm area. And it is very defeating to patients because they can work out, they can tone, they can, do all the things, but you are not going to get rid of excess arm skin by yourself.
Absolutely.
No. So where is the scar?
So there's two different schools of thoughts on this. So some doctors say, you want to put it in the back so that when you're looking at the mirror, you don't see it when you're blow drying your hair because it's behind your arm. But I don't like that scar because I feel like if somebody's standing behind you and you're wearing a tank top, you see that big scar. There are some people that put it more forward because then you don't see it from behind. I kind of fall in between that to where, like, when I have my arms down, like, I can talk and I can have conversations. So I like it to fall there where you're not actually seeing that scar front or back. So you
like
kind of
in the
hidden
inside.
in that mid line of the arm. And it is like I said, plastic surgery, there's a million different ways to do everything, which means there is no right way. But I just don't like that posterior scar. I try to bring those scars up a little bit so that, like, again, when you're talking, when you're wearing clothes, like, if you're talking to somebody, you're not seeing that scar. It's not front and center. It's really well hidden. So that's kind of where I like to leave mine.
Yeah, I like that.
So what is the process? We're talking about scarring. I feel like we're jumping the gun. How do you
Sorry.
do a
Sorry. I'm like,
brachioplasty?
So
what is
we're
a
already done with the
brachioplasty?
surgery.
So we're doing a combination of liposuction, and then obviously we're marking the patient before. After we do liposuction, we recorrect our markings, and then we actually go in and kind of map out where we want our incisions to lie, and then we'll remove that excess skin, and then close. So it's not necessarily a painful operation or an uncomfortable operation. We're not doing anything to that underlying muscle. So really it's not to say it's simple, it's not easy, but it's not a terribly, horribly recovery when it comes to kind of post-op care.
So,
things like that.
With that being said, so you said that you do the lipo and then you go in and remark everything because now we have a completely different arm that we're working with. And then after that, cutting that skin out, getting them to go, and then it's like, you're good. What type of recovery is associated with?
The recovery really isn't that bad. A lot of times we are combining this with other procedures, but when we're doing just a straight brachioplasty alone, it really isn't that painful of an operation. You do wear a compression garment. You wear that for about 6 weeks. It looks like a bra with arms. That's what I kind of explain to people. It goes right below your elbows. Honestly, I'm not placing drains. It really isn't a terrible recovery. Maybe a day of pain medicine, if that. But it's really not a horribly painful recovery. It's really not a very cumbersome recovery. Like tummy tucks, I tell patients, like, that's like the gold skinner. Like, that's going to be the hardest of all the recoveries that I kind of, put patients through. But arms, like I said, really, it's not a painful recovery. It's just the skin removal. You'll feel some incisional burning discomfort there, but for the most part, really.
How long do you have incisions or stitches?
Stitches. So what I do now with all of my brachioplasty is actually, they're all internal sutures. So we're not taking out sutures anymore. We used to do the interrupted sutures. Now I'm using the Brigitte closure device. Basically, it's these little plastic clips. I call them steri strips on steroids. And what they do is actually it takes the tension off the incisions, because immediately after surgery, you're going to be swollen, you're going to get puffy, and tension creates worsening scars. So what these Brigitte clips do is it actually takes that tension off those scars.
I feel like it does like this.
Yes.
Like it holds it.
It just kind of holds
like
things.
it clamps it, right?
Yes, it clamps it together, takes that tension off the scars. They stay on for about 2 weeks. You can shower with them on. You can, keep them clean. They really aren't as cumbersome as like some people get a little nervous by the way they look. But truly, I've been using the Brigittes for about 2 years with my arm lifts. And honestly, their scars at 6 weeks look like a 6-month scar, because the scars are going to go through phases. They're going to look good. They're going to get red and angry. And then 6 months to a year, they're going to fade. That's the natural progression. But now that I've been using the Brigitte closure devices, honestly, I've seen my 6-week scars look more like 3 and 6 month scars.
That's great.
So we're seeing a lot of improvement. And then it also takes, some people will do the interrupted sutures throughout the arm, which I don't have to take out. It's usually our nurse practitioners or nurses have to take them out. So it takes that kind of element out of it. You don't have to sit there and take out those individual sutures to take the tension off.
Is there any like limited range of motion like after the surgery?
I tell patients, within reason, it's really about, I tell a patient common sense. Like if you're doing something, it's uncomfortable, it hurts, then stop doing it.
Stop doing it.
When I used to operate on kids, because I did pediatric surgery. Kids, when they hurt, they sit there, they don't move. We're moms. We're going to do everything, because that's just like how we're going to like work through the pain. But I tell patients immediately post-op, the first, 6 weeks or so, I'm like, look, if it's uncomfortable, stop what you're doing, think about what you're doing, get some help, reposition, do things. So I tell patients just within reason, like you can wash your hair, you can do that, you can move. I want you to move. But like at the end of the day, I also say just common sense. Like if it's uncomfortable, stop doing it.
This is a perfect surgery for the winter time.
Yes,
Throw on
absolutely.
a sweater and like
100%.
nobody.
So say a patient does not have, in your opinion, an adequate enough excess of skin to do a full brachioplasty. So I want you to touch base on non-surgical options, so J-plasma with lipo, and then a crescent incision, and kind of explain what not non-surgical, but
other options. Small options. Yes, absolutely. So there are some patients come in and they just really have like a fatty collection there, and they've got good skin quality. Those patients are actually good candidates for just liposuction alone. So you can really, circumferentially liposuction it. J-plasma I like as an adjunct to that, because it's going to create that skin tightening under that skin. There's as far as crescent arm lifts, like I don't love that procedure as a whole, but it's also because you don't usually see patients where they just have.
What is it? Explain what it is.
Basically, it's going to be a little crescent scar that is in your armpit area. I don't think it gives a great scar, but then also the patients that are coming in to see me, they really have that skin excess. So you can't like halfway do this procedure.
Yeah.
So like if I just did that alone, it's not going to address that laxity in the lower portion of the arm. So if you have a small pocket right under that armpit area, then yes, I can make a case for it. But for the most part, most patients that are coming in, they've got that excess in different directions.
Down. Yeah.
But like I said, I do like liposuction and J-plasma as a way to prevent those scars if I don't need to do them. Because obviously I'm not trying to make big incisions unless I absolutely need it. So there are some patients that come in and I'm like, look, I think you could do just liposuction. You could do J-plasma and you would have a very nice result.
Yeah.
So
Okay.
as long as you're not worried about that.
But can y'all explain what J-plasma is for?
So yes, so J-plasma is a helium-based laser. So we're usually doing it in conjunction with liposuction. So we'll perform our liposuction procedure, and what it does is we pass this laser. It's a helium-based laser. It'll pass kind of a plasma that'll go right under the skin, and what that does is it kind of creates a skin tightening, and it creates collagen formation, which will then create a little bit of tightening. So it's kind of something that's used adjunct to that liposuction.
Nice.
Yeah, it's skin tightening with lipo. So lipo, you're removing the fat cells, right? You're removing all of the adipose tissue below that area. So it's going to leave you behind actually with a little bit more skin if you were just to do lipo alone, if your skin quality is not perfect or great. So that's when she brings that on to remove the excess fat, but then also tighten with it.
Back up.
Yeah.
This may be the first time we've ever talked about lasers without the laser spiel.
Oh gosh, we haven't talked about J-plasma yet.
No, yes, we have.
Yeah, no. I think we did.
I'm
We
sure
did
y'all
J-plasma. Yeah.
Okay.
What? No, you go ahead. I feel like you were about to say
No,
something.
nothing.
Go ahead.
I think that it is the most intimidating surgery that we do because 100%. The scars show. And so I think that you have to have a very trusting patient, and it is a very handheld procedure. throughout the recovery. Now, whenever somebody heals from a brachioplasty and has that nice tight arm, which we're about to bring on a patient who can kind of testify to this, it is probably the most rewarding results because it is completely transformative. I have so many patients who will not wear a sleeveless shirt. In Louisiana, it's so hot. They're so self-conscious.
9,000 degrees.
But they'd rather
wear long sleeves.
They'd rather wear long
show
sleeves than to show their arms. So this is such a rewarding procedure. It's fairly safe, fairly quick. Dr. Hogan's going to make sure you're, the perfection of a candidate. And then once you do it, and then with this new device that's holding it closed, the incision fades to pretty much nothing.
You would do the same scar therapy? I know we kind of touched on scar therapy before.
So with the Brigittes, we'll actually do the Brigittes for 2 weeks, and then as they pop off, we'll start our scar therapy process too. We're doing everything.
Let's back to pop off.
So they're just adhesive. Like I said, it's just like these little sticky little steri strips. It's like it's
like a pleated steri strip, kind of
steri strips.
Yeah, that you just like it just holds it together.
And like as the adhesive comes off, it's about 2 weeks. They'll just kind of like, oh, it fell off. I'm like, it's okay.
It's fine.
It's okay. So we have a bunch of them on there. So yeah, it'll be fine.
I can see me showering like, pat. Like,
yes.
Oh, gosh.
No, they just kind of fall off.
Yeah, but you still have sutures underneath the skin that are holding tissue together as well.
This is just on the outside.
Yes.
On the outside.
Yes. I'm excited to talk to Michelle. She's going to give us kind of her firsthand experience of what she went through and, the results that she's achieved because she was very self-conscious about her arms. So, yeah,
Let's do that. Let's take a quick break. We are going to bring our patient on in just one moment to share her experience and story and what this surgery has done for her. So stick around and we'll be right back.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. The college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
Hey everyone, welcome back. We have our patient here with us. Michelle, thank you so much for joining us today.
Thank you for having me.
So Michelle, tell us a little bit about yourself, kind of who you are, what you do, where you're from.
I am a mother of 1. She is my best friend. Her name is Abigail. She is absolutely amazing. She is my best friend.
How old is Abigail now?
She's 11.
Is she really?
Yes, and I've been with Weiler Plastic Surgery for 9 years now, so I am not naive to surgery or any of these things. So I'm really glad to be here to be able to talk about this in particular.
Well, great. I love this. I absolutely love this. All right, so obviously, like we had said, like we've been talking about, we're talking about brachioplasty, removing this. So you were like, all right, I got some extra skin. What do I do now?
Well, tell us, start back more of like your aesthetic journey.
Yeah.
Because you have quite an aesthetic
I do.
journey.
Well, like to go back to the very beginning, I was overweight at a very young age, and I have gained weight, lost weight, gained weight, lost weight over the years. So my skin was stretched. And my first surgery was a breast aug and lift. My second surgery was a tummy tuck. And then my third surgery was the brachioplasty. And they all have been transformative for me to help me be more confident in my skin, because that's ultimately what I want to be, is confident. And that way I can be an inspiration to others. That's what really fills my cup.
That's why you're here right now talking about
exactly.
That's it. That's what we love to hear.
So you did your breasts and your stomach, and then did you feel like your arms was the last thing that was like, it was still bothering you? Like you felt more confident here, and then your arms were your focus?
So like, to be completely honest, my clothes didn't fit, and I had so much excess skin, or to me, I had so much excess skin that like I could raise my arm and do this and I could just hear it hit my side, and it would be so embarrassing to me. And like Dr. Hogan, you have been fabulous. I was really able to connect with you, and you really understood how I felt.
Yeah.
So I knew going into this that I was going to be in good hands.
Yeah.
But but when she did approach me, I was like, really? Like I've never, like it wasn't something that I noticed, but like when you started describing like kind of what you were going through, I was like, okay, like I didn't even like, so, and it was funny because like what she perceived and what I perceived were completely different things. 'Cause, like I never even said, oh my gosh, she could use that. But when she finally kind of opened up, and like you did wear longer sleeves and things like that. So I guess I never like saw it. But then when I finally examined you, I was like, okay, like I see where you're coming from now. This makes sense now. Like, but like just looking at you before that, it wasn't something that was like overt. But like it is one of those things where like you've got your thing. This is affecting you. Like, what can I do to fix this? And that's where I come in. Like, oh, we can do something about this.
Yes. Was it skin and fat?
Mm-hmm. Yes.
Both?
Yes. More skin. I mean,
It was a combination, but really, honestly, it was that skin that was kind of really what you were kind of concerned with. You could see it moves. It made you have to wear bigger shirts and things like that. I think that's really kind of what it came down to.
And I mean, I had clothes in my closet that I would keep and I would still wear, but I would have this dress and I'd wear it to work, and then by the end of the day I was so miserable and I couldn't wait to take it off because it felt like it was cutting circulation into my arms. It was just absolutely miserable. But like, I fell in love with this red leather jacket from a boutique that I bought 6 years ago. It is still in my closet. I've never been able to wear it because it's been so tight fitting on me, and this winter I'm going to be able to put it on and I'm going to be able to be confident. Awesome. And I've waited 6 years. Like, I'm not naive to the surgery, but for whatever reason, I always thought to myself, I'm never going to get this done.
Yeah.
And then I got it done, and I've just been absolutely ecstatic about it.
Yay!
And you can that just like hanging out in the back of the closet.
Yeah.
You can see her confidence though too. Like it's different. Like, and again, you weren't, not that you weren't confident before or anything like that, but like I can definitely tell like there's like a little bit of more of a sparkle to you, because like I feel like you feel better about your clothes, and you can see it. And again, it wasn't that like, if I looked at you before, I was like, oh God, something. But like now there is a difference. Like I do see you when I see you in the offices and kind of see you in the clinics. I'm like, oh, like she looks like she's doing good.
Thank you.
So you finally decided, talk to her, obviously. And then she was on board with it, had the procedure, and probably were at work soon after.
Oh yes. Yeah. Oh yes. I remember, right before, like I went into the surgical center and she is right there. I lay down, and for a moment I just got, I don't want to say scared. It was excitement, but I had this tear fall from my face, fall from my eyes. And I'm looking at Dr. Hogan, and I'm just like, it's going to be fine. Like, this is it. I was just so excited. And then right after surgery, I don't remember much because I'm coming out of anesthesia, but I do remember it was Dr. Weiler's clinic, and he had just walked through, and I'm like, hi, Dr. Weiler. But I was just so excited. I was extremely excited afterwards.
I feel like that was the last piece to your journey, right?
I don't know. I might be on the schedule for a thigh lift eventually. You've got to think so when I was pregnant with Abigail, so I was overweight most of my life, like I said earlier, lost a lot of weight, gained a lot of weight. But when I was pregnant with Abigail, I can't believe I'm saying this on the podcast, but I stopped weighing myself at 236. And wow. I just blew up in that pregnancy. And so I have a lot of skin that had stretched, and my thighs are my next, but we'll see what the future holds.
That's great.
So it's like she'll be on your schedule next week.
I'll take all the work.
It's like for a thigh lift, and you'll be good to go. And then we'll have you back on so you can talk about your
I can do that.
That's perfect.
What was your experience recovery wise? Like emotionally, mentally, physically?
Being that I've had other surgeries, mentally I was fine. I mean, we as patients, we all go through that phase of, oh my gosh, what did I do to myself when you're seeing this incision and you're swollen? But I knew that it was just a phase, and I'm going to love this. I was scared. You know, it's always like, expect the worst, but pray for the best. I think that's the phrase. I was scared I was going to be lumpy, bumpy, with everything, and I was going to see the scar, but I'd much rather the scar than the skin.
Which is so funny. I mean, everybody who's watching, like, no, you can't see her scar. Like, you can't. Just like
Dr.
you were
Hogan did
saying.
amazing. And they are hidden. You can't see it unless I will do it. Like, there, and I'm so happy with it. I am so happy with it. I could not, and I forget that I've even had the procedure done. It doesn't bother me one bit. I went to a murder mystery recently, and I would have never done this before, but I got on the mechanical bull for the first time, and I am holding on to that bull, and I've got this arm up, and I'm waving, and I would have never done that.
I have so
Can we
many
get video
questions.
footage?
I do have video
I'm gonna
footage.
need this for the podcast. We're gonna need the picture of that.
I have so many questions on why there was a bull at a murder mystery.
I know.
I
It was a Western.
Where were you?
Western.
It was like, who was murdered? This is like, there's a mechanical bull. Okay. Like I said, so many questions. That's another episode. So tell us, like, obviously you said that this was something that was, this is near and dear for you. Then what, from your standpoint, like the confidence level that you had after, it seems like, are you like you said, like the jacket, I feel like every girl has that one piece of clothing that's in the back of the closet that's like, oh, I'm not going to throw it
Not
away
getting
yet.
rid of it.
Not there yet.
Getting rid of it. And it's like, and now you get to do that. So it's like, where are you at now? Because how long ago was the surgery?
Almost a year. November 26th would have been a year.
Almost a year.
Be a year.
So like over this past year, and we kind of talked about the emotional roller coaster that's associated with surgeries and stuff. Like, where are you at with your mental state after this?
I am perfectly fine. I am so happy. I mean, just look at this shirt, for instance. It's not snug, but it fits around my arm perfectly. I would have never been able to wear this shirt before because you would have seen it would bulge out like a popped can of biscuits.
There we go.
I have known you for 9 years, and I never noticed your arms.
Yes, that's exactly my point too. Like I didn't,
But I think you camouflage, or like,
yes, I think it was that
you hid them maybe.
I did. I tried to hide them as best as I could, but I would despise the winter months because, I mean, I would have to buy bigger sizes just so it would fit my arms because if not, they would be tight and I would be restricted. So I'm really excited about this winter and getting clothes and just being able to feel good in my skin.
Okay, but for me,
good.
this is the best part. So I've known Michelle now for probably like 5, 6 years, I think. Okay, I never knew that she had a surgery. I didn't know that she had.
She had this.
So I had no idea. I had no idea because I've never seen a scar, and I'm like, and I work in very close.
We pass in the hallway all the time.
Michelle,
You're like, not like,
there
oh
is
my
a
gosh.
lot of arm movement conversations that have taken place and happened, and never would I have ever. I did. I literally just saw her in the hallway. I was like, "Oh, morning, Michelle." Never
I like your
thinking
hair.
that she was coming.
Oh, really?
To talk about arms, you
Like-
didn't know she was.
Okay, like did not know that she was good, that
Surprise.
she was the patient.
Yeah.
And I walked in, I'm like, oh, Michelle's the patient today. And Grace, don't get mad. I did not read the outline, but like,
It's okay.
I like don't get mad, Grace. It's just been a week,
What were we
okay?
talking about?
But never did
Okay,
I
that's
put the
good.
2 and 2 together that she was coming here to do this because
right.
this was the surgery that she had. Never, ever.
Yeah.
Would I have ever seen?
My gosh.
Also-
Dr. Hogan did an amazing
No, well,
job.
and like I said, it was funny. Like when you did approach me, like I think you approached me
It
in
was so
clinic one day.
informal.
No, you're like, hey, so like, can we talk about my arms? I'm like, what's wrong with your arms?
What's wrong
I'm
with
like,
your arms?
what? I'm like, what are you talking about? I'm like, well, like, yeah, go on my schedule. We'll get taken care of. But it was really one of those things. Like I had no idea that this was even an issue for
Well,
her.
that's what I'm saying.
And
Like
then
I've known you for
now-
5 years, never
Exactly.
arms and whatnot. But like I noticed that you wear, like short sleeves and stuff like that. Never would.
But what's your perspective of it as far as like when you did the surgery for me and how much skin you were able to take off?
It was a fair amount of skin. Like it was more than I thought that I would get. Like because again, like you didn't have like some people come in, they've got the stretch marks, they've got that lack of elasticity, they've got no collagen in that tissue. And like looking at you, I was like, you really didn't look like you had that much. But honestly, once we do that circumferential liposuction, so you're kind of thinning out the whole arm, you can get a little bit more of that skin, and you really get a good sense of like, okay, there really was excess here.
Yeah.
And again, like I said, this is one of the hardest procedures I do in the sense that like I don't like putting scars on patients that they can see, but just seeing Michelle, and honestly, like my brachioplasty patients are really some of the happiest patients I see. Breast reduction is another one where patients like exude the confidence. This like for her, and then also my other patients, like they really are so excited because and again, being in South Louisiana, it is so hot. Like being able to wear a tank top is like a huge deal. Yeah. So like I definitely see it, and like I said, now that I see Michelle around, I'm like, oh, okay, like she's wearing, and like sometimes I'll see her on social media, I'm like, oh, look at her, go ahead. like she looks great.
I know they have this one picture. We did our team bonding, and we went to a restaurant, and they have this one picture of me, and my arms are out like this, oh, and you honestly would have thought that I edited my arms, and I didn't, because they looked so tiny.
That's so good.
I looked at pictures and I saw her the next week. I'm like, girl, go ahead.
Oh, I love
good
that.
Job.
That's awesome.
Just like, look at them arms.
I'm like, look at you, girl.
What would you tell, this is always my favorite patient. What would you tell somebody who's been battling silently the insecurities that you held?
Do it. Like, what is there to lose other than the access skin? I mean, you're just going to gain that confidence. It's one of the best decisions. I mean, all of my surgeries have been the best decision. It's completely changed me.
Yeah. Wow.
I love that. So and I, you know, just like you were saying, you know, with the scars, and obviously, you know, like you said, it's very, you're like, oh, I'm gonna leave a scar, you know, in that plastics world, but that this surgery is so powerful because you don't care about the scar, you know, and it's so powerful to the individual that's having it done, because it's like, no, you can throw a scar in there. Like, by all means.
If I don't have that skin, I'm happy.
But I will say,
the skin or the scar.
That's right.
The scar has to be a very delicate, fine scar. And so you have to go to a specialized plastic surgeon who knows how to do a very good brachioplasty, because I have seen not kind scars and not properly placed scars on brachioplasties.
Yes.
So I think that
it is technique. It is very technique. Yeah. So some doctors will take a little bit too much. And I tell patients come in like, I want all of this gone. And like, they're squeezing their arm as tight as possible. I'm like, okay, if I take that much skin, we won't be able to close you. And that is a big problem. So I tell patients, like, your scar will be wide because of that. So like, you know, scarring, it's there's multiple reasons why you scar badly. So it's genetics. Some people just have bad scars. That's just their genes. It is surgical technique. That is a big, huge component of this, tension on scars. And that's where the technique, and then also the Brigitte closure device, like that, actually both of those things in combination of, like, you know, take care of that end of it. And then also the post-operative, like what you're doing. Like, so the patient is doing their scar therapy, staying on top of it. And again, that goes to, like, we see them multiple times throughout the recovery process. You know, hey, do we like the way this is looking? No, let's get you set up with a laser. Let's get you set up with this. And like, we will really we have so many things that at our disposal that we can kind of do to help improve those scars. So I am lucky in the sense that, like, yes, it is surgical technique, but then also like that post-operative, I've got the backup of all the lasers and things at my disposal, all the resources that I've got.
Which is, I mean, we say it all the time. I know every single one, like, make sure that you are going to the appropriate person to do this. You know, like you were saying, you're like, neck down, that's all I do. You know, it's like, so I wouldn't go to Dr. Hogan and be like, I need a facelift. You know, it's just like,
I can do
things.
It.
I was about to say, she could.
I can. It's just my comfort zone is neck down.
But that's what I'm saying. It's like, you find these surgeons that, like, this is what they do. This is their bread and butter. They're good at it. It is their specialty. Make sure that you find somebody like that to do this journey with. Because like you said, all these follow-ups, it's going to be a journey. It's going to be a relationship. It's going to be very important that you find that perfect person to go with.
And then you see me a lot. And then everybody knows my hands are freezing. So I always preface them like, my hands are cold. And by like the 6-month mark, like, we know your hands are cold. Like, I know, I'm aware. And I try, but like, I'm like, my hands are cold. They're like, we know. So
what is it? Cold hands, warm heart.
It is, exactly.
Right.
So I'm like, sorry, I'm about to, like,
she cares.
Like,
it's cold hands,
I get that every time. They're like,
heart.
we know.
Okay. Wait. What are you doing this afternoon?
This afternoon, I'm doing a radioplasty. So I'm actually heading out. I've got a couple of cases and I've got an arm lift too.
That's amazing.
It is for a weight loss patient, actually a Rejuvime patient. So I'm excited. So
I
absolutely,
full circle. So good.
Full circle. I'm like, yes. And like you said, because this is so associated with this GLP-1 movement that's absolutely happening with everybody losing skin, but knowing it's like making sure those individuals know that there are options.
Yeah,
you know. And
you said you were going to add a tagline or add a little snippet about elastin. What were you going to say?
I prepped my skin prior to the surgery, I used the elastin reform and repair. And I think that has been very beneficial through my whole recovery.
Yeah.
So yeah.
Okay, what's that? What's Elastin Reform and Repair? What's that?
It is a product that you use for surgery to help recover faster and heal a lot better.
So it's something that we actually are doing with pretty much all of our patients now. So it's just a way to prep that skin. It helps with bruising. It helps with swelling, things like that. So we're doing that actually, is it 2 weeks before? And so the patients are going to, wherever we're operating, they use that. And then they actually use it in the postoperative period too. So we're doing everything that we can to help the recovery process.
And then
Absolutely.
like with the Brigitte clips, I tried so hard. I think some of them lasted me to 4 weeks.
Yes.
I tried so hard to be so delicate, and my husband's trying to put me back into the sleeve, and we're trying not to hit the Brigitte clips because we wanted them to stay on as long as they could.
And they did. Yeah. And so, like I said, like that, honestly, with the Brigitte's, like that's been a game changer. And like I've been doing them for about 2 years, and in my arm lift, that's just a complete game changer with the scarring. I'm definitely seeing better looking scars.
So fun. Okay. Dude, what did we miss out on? Did we
covered everything.
We covered everything.
Yep. I love a happy patient to close out the episode.
Me too.
I love a confidence, like the confidence
truly.
after every patient that we talk to has had procedures after. It's just that confidence that they have. I think that's like the most important.
Truly.
Thing is just like restoring that that we had. Michelle, thank you so much.
No, thank you for having me.
Joining us, telling us your story. Dr. Hogan, thank you.
Thanks for having me.
Coming
this
and
was
talking.
Fun.
This was exciting.
It was fun. It actually was.
You'll come back. You'll come back.
I'll come back.
She came and met with us before a day of operating. So like big props.
That's it. I know. I was like, so once again, the operation, she's been up since 4.
And I'm wearing makeup on an OR day, which never happens. Usually it's like sunscreen and some mascara. And then whenever I see the estheticians, I'm like, don't judge me right now. This is not a clinic look.
That's what, Taylor, we'll just do like a clean face episode.
Yeah.
Yeah, we really should. That's a good idea.
This is not a clinic look.
Do a clean face episode. That'd be good. Well,
see all the melasma.
All the
all the things.
If I took
we're
this
battling
off,
it right there with y'all.
I was like, if I took this off, oh my heavens. Me and my eczema, girl.
We're here for it.
Y'all, my retinol is just about peeling my skin
all your
off.
skin
And
off.
of course, today, we're doing this.
It looks
I'm like,
good.
can I cover it?
Yeah, it's good. Looks great.
Well, thank y'all for joining us today. Remember to like, subscribe, follow us on all the platforms. Make sure you are tuning in on wherever you listen to your podcast, whether it be Apple, Spotify. Follow us on the YouTube, TikTok, Instagram. We're all over the place. But also make sure, always ask questions, always stay informed, and remember to always consult before you cut. We'll see you guys next week.
Yay!